Let's jump right into this explainer. Whether you literally just rolled through your front door from the hospital or you're gearing up for an upcoming procedure, we're going to distill some world-class medical guidance into a totally practical, no-nonsense guide. Our goal today? Super simple, but absolutely crucial, helping you safely regain your independence after a primary or revision total hip replacement. You've got this brand new joint, right? So now it's time to figure out exactly how to actually live with it. Okay, so think about this deeply frustrating, almost universal challenge of recovery. How on earth do you put on your socks when you literally cannot bend over? Honestly, it sounds like the setup to a bad joke. But when you're standing in your bedroom at 7 in the morning just trying to get dressed, yeah, it is anything but funny. Getting your socks on safely, that's actually one of the ultimate tests of your recovery protocol. It's that exact moment where all this medical theory smacks right into your daily reality. To get you past that annoying morning hurdle, here's our roadmap for today. We're looking at 1. Your new hip joint, 2. Crucial hip precautions, 3. Essential dressing aids, 4. Putting on socks safely, and 5. Protecting your recovery. All right, let's start with section 1, your new hip joint, the foundation of recovery. Before we get into the tactical step-by-step of getting dressed, we really need to look at the bigger picture. Based on guidance from Medline Plus, joint care is not just some boring list of medical requirements. It's an active, empowering daily practice. Taking care of your new hip means being incredibly intentional about your daily maintenance and executing very careful, deliberate movements. When you undergo a total hip replacement, whether it's primary or a revision, the muscles and tissues surrounding all that new hardware have been disrupted. They need time to heal, to tighten up, and to stabilize everything. So literally every move you make in these early weeks is either helping that stabilization or putting it at risk. You are essentially the project manager of your own healing right now. Which brings us to section 2, crucial hip precautions, establishing safe boundaries. Let's look at how that active mindset translates into actual protective boundaries set by top orthopedic authorities. We're talking about hip precautions. These are specific, temporary medical guidelines from hospitals like the RNOH designed to protect your new joint while the surrounding tissues heal. I really want to hit on that word, protective. It is so easy to view these rules as, annoying restrictions just keeping you from your normal life. But they aren't. They're a temporary shield. They're basically the rules of the road to prevent dislocation during your absolute most vulnerable phase of recovery. Now, looking at the do's and don'ts, the safe side is pretty straightforward. Keep your legs facing forward, use high chairs, but look closely at those don'ts. The absolute golden rule of hip recovery, never ever bend your hip past 90 degrees. Picture an L shape. Your torso and your thighs should never close tighter than that L. So no leaning forward to tie your shoes, no hugging your knee to your chest, and absolutely no bending down to grab a dropped TV remote. Breaking that 90-degree rule puts massive mechanical stress on healing tissues, and honestly, it's the fastest way to pop your new joint right out of place. Moving right along to section 3, essential dressing aids, tools for independence. Knowing the rules is only half the battle, right? We need the tools to actually live within them. The RNOH highlights a crucial perspective here. Proper use of dressing aids fosters daily independence while maintaining those strict precautions. Think about it. If you can't bend past 90 degrees, how on earth do you reach your feet? Well, you extend your reach. Tools like a long-handled shoehorn, a reacher or grabber, and specifically a sock aid are going to be your absolute best friends. Embracing these tools doesn't mean you're cheating or failing at recovery. It means you are succeeding. It's how you protect your hip while still getting on with your day. A real game changer. It's all about working smarter, not harder. Okay, section 4, putting on socks safely, the AOS method. Now let's translate all this theory into a safe, reliable morning routine. We're going to slow down a sec to walk through the official step-by-step from the American Academy of Orthopedic Surgeons. This is exactly how to get those socks on without breaking that 90-degree rule. Step 1, prepare your dressing aid. A sock aid usually looks like a flexible plastic trough with a couple of long ropes or straps. Step 2, while you're sitting down safely, slide the sock completely over that plastic trough. Make sure the toe is pulled tight against the plastic. Step 3, grip those long straps securely in your hands. Now, step 4, and here's where the tool does the work for you. Lower the aid down to the floor in front of your foot. Notice what you didn't do. You didn't bend over. Step 5, just slip your foot right into the opening that the trough is holding open for you. Finally, step 6, gently pull those straps up toward you. The plastic core slides smoothly right out, leaving the sock perfectly in place on your foot, and you stayed sitting completely upright. Takes a little practice, sure, but once you master this, getting dressed independently again is a massive relief. Let's wrap things up with Section 5, Protecting Your Recovery, Long-Term Success. The overarching theme across Medline Plus, the AAOS, and the RNOH is loud and clear. Protecting your new hip today ensures your lasting mobility tomorrow. Strictly respecting these precautions right now is a direct investment in your future freedom. Look, I know it is incredibly tempting to cheat just a little bit, to bend down just that one time because you're rushing. But those healing tissues around your new implant, they do not care that you're in a hurry. Taking the extra 60 seconds to use that sock aid, choosing the higher chair, actively adhering to that 90-degree rule, these aren't just chores. They're literally the foundational building blocks of a recovery that's going to give you back your active lifestyle for years to come. So I'll leave you with this final question to chew on as you navigate your recovery journey. What small step will you take today to safely reclaim your independence tomorrow? Healing from a total hip replacement is not about giant leaps. It's all about the small, disciplined choices you make every single morning, like exactly how you choose to put on your socks. Empower yourself with the right tools, respect your boundaries, and your new hip is going to serve you amazingly well. Thank you so much for hanging out with me for this explainer, and I wish you a safe, smooth, and super successful recovery.